I'll introduce Tamie Young, who I worked very closely with my first 2 years at Stillwater Medical in practice management. She is in the business office, and I'll let her tell you all of the great things that she does every day, but really she's an expert when it comes to Medicare and presents on the national level. We're very fortunate to have her. She spent over 10 years in the Integra system, so she knows what it's like to be in an independent hospital versus a big system, and we're just grateful to have her with us today. And so with that, I'd like to welcome Tamie Young. Thank you, Tamie.
Thank you all very much. I am Tamie Young. I'm an assistant administrator at Stillwater Medical Center with the responsibility area being the business processes. They call it the revenue cycle. I know that's kind of a confusing term, so you can just think business processes, billing, that kind of thing. It would fall in my purview for the hospital and the clinics. It is my pleasure and honor to be here with you today. It's my passion to be able to explain not only the business of healthcare, but healthcare processes. I just had an amazing, probably life-changing experience. I just returned from Uganda 7 weeks ago, and I went on a medical mission. It was my first. I've never been on a medical mission before, and I didn't know what to expect, and to be honest with you, without being clinical, I didn't even know what my role would be. Even though I learned a lot, I did everything required of me before going, I'm on an airplane traveling miles and miles from home and to Uganda, and not knowing what am I going to do until the first day we rolled out. And what I learned is, one, something that we all already know, how fortunate we are to be Americans and for the blessings that and opportunities that we have here. But the other thing I learned is that no matter where you go, people need to know and need to understand what they're involved in a healthcare process. And that I learned that everyone appreciates knowing. So what I did there was not only helping steerage of patients through the clinics. We served about 150 patients a day. We had 5 providers. You roll into a church and you set up a clinic from scratch. And but I ended up finding out that my calling was to be able to explain how to take medications to patients, or how for patients to take their medications. And it was something I totally didn't expect, and but everybody seems to appreciate being able to understand the process of the healthcare that they're involved. So that's the passion that brings me here today. We're going to cover a little bit. How many people have been to these sessions before and heard me speak? Okay. Thank you, Jeffrey. So you know that I cover usually Medicare basics. I try to get in the weeds a little bit on some of it. Today, I'm going to bring this to you a little differently because a large portion of the audience, I'm willing to bet, how many people are just getting ready and learning information for their Medicare years, or you've just entered your Medicare years? Yeah, I'm close there with you too. So it takes on a whole new meaning. So the way I'm going to present today, we also have some changes, about the talk about Medicare and things like that in our environment. And I'm going to cover some of those items today too, to bring you just a little bit more information. I will watch the clock, leave time at the end, and if you, sir, would you be on watch?
Sure.
Will you be my timekeeper?
Sure.
Will you tell me
What does
when
it pay?
it is? Huh?
What does it pay?
What? Oh,
No pay.
Nothing. Free
it'll get you a business card and free access to me. Of course, everybody else gets one too. But okay. It's 12:45. If you'll motion me, we'll stop and make sure we have time for questions. Okay. All right. So let's get going. So did you know that in 2018 it is anticipated that Medicare will pay out in benefits to 60 million individuals on the Medicare program? 60 million, that's just such a huge number. Benefits are paid at it's estimated $704 billion being paid for Medicare benefits and health care this year, by the time we end 2018. It's incredible. I will tell you, for those that have been in my presentation before, that is about $4 million lower than what was in the budget and estimated last year. So that goes to cuts and things like that, probably. So Medicare is the nation's largest health plan. We think about insurances and purchasing and things like that. And we're going to talk about that today, about who we are and our involvement in this whole healthcare process. But they are the largest health plan. The largest health plan. And a lot of times we don't think about it that way. A lot of other things come into our minds when we think about Medicare, Social Security, and that type of thing. It is available to individuals 65 years of age or older, under the age of 65 if you have a disability, or if you have end-stage renal disease. There are qualifiers, and then you become eligible for that too. That was a special program that came into existence in the 70s. All right, I lovingly call the Medicare benefit plans the alphabet soup, because we're going to talk about Part A, Part B, Part C, Part D, and what your requirements are, what you have to do, what they cover, that type of thing. Part A is your hospital insurance. I'll talk a little bit more about that in a minute. Meaning that is the core principle that Medicare in the 60s was rolled out to cover. Because back then, most everything if you needed hospital treatment, you were an inpatient in a bed. And there was rising costs, but it was developed to cover those services that you had. As we fast forwarded and our medical abilities and treatments and all those kind of wonderful things that we have access to today, outpatient then became more prevalent. So then came Medicare Part B. So Part B is something you pay for, and I'll expand on that in a minute. Typically the payments come out of your Social Security check, but you can pay otherwise. Part C is the Medicare Advantage. That rolled in as we began going through the 90s and into 2000, where it became evident that maybe commercial insurance plans should get involved in the Medicare program. They would be subsidized by the Medicare core plan, the trust fund, and patients would begin to have an option. They rolled out and were common in larger metropolitan areas. Those of you who have heard me talk before, you're going to hear a little difference in the way I talk to you about those plans today and the things I would like for you to consider. Part D is the drug plan. In 2006, everyone that was on the Medicare program was, I'm going to say required loosely, was strongly suggested that you have a Part D plan. That's to help you offset the cost of any medications you have you purchase through the pharmacy. That's separate from what is covered during your health treatment in Part A or Part B. So Part D is a really, really big thing. You know, we've had big conversations about that in the past. So the basics, Part A, what does it cover? So Part A is going to, like I said, cover your inpatient stay, but also under there is your skilled nursing facility. If you need some extended care to get back on your feet, sometimes you hear that called a SNF. That's going to help cover that. Your home health, your hospice, all of those funds come out of the Part A fund that you do not pay a premium for. Okay? As long as you've worked 40 quarters in your life, you are eligible for Part A, free of a premium. Part B, this is what you use mostly, your outpatient services. So think of your physicians, your doctor's offices, your outpatient tests, things like that. That's what's going to be covered under Part B. If you need durable medical equipment, oxygen, things like that, it's covered under that program as well. Medicare Part D, the drug program, I want to go through this just briefly before we get into kind of some tips and tricks and start going through the frequently asked questions. How many people in here have a Part D drug plan separate from another insurance plan. You're paying separately for a Part D plan, right? So Part D has a lot of rules, but its major purpose is to pay based upon drug formulary tiers, meaning you have generic, you have name brand, you have more high-end drugs. They are based to pay so much for each of those tiers of medicines. You then have a part in that, a portion that you pay based upon each tier. To give you an example, if you had, say, a tier 1, which would include a lot of generics, maybe your copay is $5, depending upon the plan that you purchase. Maybe a tier 3, a higher end drug, maybe you not only have to pay $50, but you have to pay a certain percentage of that as well. So there's different rules based upon the types of plans, and there's many drug plans to choose from when you're purchasing them separately for maybe another either secondary or a Part C plan. One thing that we've gotten into over the years is I've talked in the past about the donut hole, meaning the drug plan was designed that an insurance plan would pay so much, and then after it pays and you pay your copay together hit like $2,700 or whatever that magic number is, then you're going to owe a larger portion for a period of time. Then the plan kicks back in and pays. A lot of details in a Part D plan. The lesson I have for you here is you need to have it. If you are late signing on to it, you will be penalized, and it will cost you more to sign up for a Part D plan. So for those just coming on Medicare, I'll talk about your group health plans in a minute, but my takeaway is it's important for you to have a Part D drug plan somewhere in your portfolio of insurances. Best little story, and here's why I know this firsthand. So in 2006, my father and my stepmother were very healthy and fortunate to go south for winter. They had a motor home, and that was just the love of their travels, and look forward to it every year. They were healthy. They didn't take any medications. And so when this came down, we read all about it, and here I am in the industry. I'm helping people get signed up for Part D plans. And my parents say, we don't want one. So I kind of give them the why they need it. And we roll on. I respect my father, and I said, okay. So you fast forward about 7 or 8 years, and they began to need a few medications. And my stepmother was diagnosed with breast cancer. And the treatment was very successful, but she needs some ongoing drugs. And we tried to get her on a Part D plan, and they said, yes, you can get on this Part D plan, but you're going to owe a penalty for so much money for every year that you didn't sign up. So we ended up paying for a Part D plan. My father passed at the age of 91 in 2015, never being on a plan, and just wanted to prove me right. And my mother, though, she was able to get on a plan, and finally she, was able to keep it going, but she had to pay the initial back premiums. So just lesson learned there on the Part D plan for those of you coming up, the why we want to listen.
How much money is that?
How much money is that?
Yeah. Like,
She had to write a one-time check because it multiplies, it was in percentages. In the grand scheme of things, I think it was about $400 because she had to pay the difference, in the premiums. Okay, enough of that. So, what role do each of us play in healthcare? One of the commonly asked questions that I have is, that people come to me with, is, Tamie, this is all so confusing. How do I know what to do? Or how do I know, why do I have to do this usually? Why do I have to search through all this stuff to find out what plan? Do I want Medicare? Do I want a supplement? Do I want another insurance? Why can't I just keep insurance like I had when I was working? All of those plans. But it all comes down to the role that we play in healthcare today. We are patients, but our environment has brought us to be consumers. So we are patients in the emotional and in the time when we are faced with healthcare decisions, and then we turn around on the flip side and we get a bill or we have to go shopping for an insurance plan, and we're a consumer. So both of those lie within us. It's a mixture of emotions, but I want you to be savvy. I want us to learn as much as we can so that we are the best patients and consumers in healthcare because that's what drives it. That's what makes a difference. So that's the way I'm going to be talking with you today. I'm going to talk a little bit about you as a patient and what I hope that you take the initiative to do, because it's our right, it's what we should do, it's our bodies, or it's our loved one. And I'm going to talk to you about being a consumer and the things that you should know and the questions that you should ask. So, first question, starting with the younger group. I'm turning 65, or I've just turned 65. What do I need to know? What are my options? So, do I have options? Absolutely, you have options. Takes a little bit of digging, a little bit of investigation. This is where you put on your little investigator's hat. You definitely have options. So, and these options are changing as we speak, and I encourage you to stay on top of this for the year 2019 and the year 2020, because I think we're going to see some exciting things happen, yet there's some things that are going to make us a little worried, maybe. So when we look at the boomers, the baby boomers, and we hear it on the news all the time, we know about it, we live it, that as we begin to tap into the Medicare Trust Fund, things are going to change. Well, remember I told you about that Part C, and I'm holding off on going into what that is right now because I want you to see the why and the where we're going with those plans. So I just returned from a conference, and this was a slide that was shared, and we talked about the shift in the Part C plans and how more baby boomers want to purchase an insurance plan like we have when we're working to extend that. And that's kind of what Part C brings to us. The estimated that starting with this year, and the trend has already started, that it will grow so that eventually, the hope is by the year 2024, almost 50% of the Medicare consumers, I'm going to use that term here, will be purchasing Medicare Advantage plans. The exciting part of that seems to be the trend as I read and I try to investigate, well, what's going to change? Well, we know that our challenge in the United States is, one, we're living longer. You know, that's a wonderful thing, but it also means that we need more care. So when we look at these Medicare Advantage plans, they're looking at ways that they can allow us to stay home longer, that we can begin to get nursing paid for, things like that, that we don't get paid for as easily now, or there's so many rules. They're looking at lots of avenues, telemedicine, things like that they could roll into these in the future. So that's why I'm showing you, we're going to have a little different conversation today. So speaking of those Medicare Advantage plans, here's kind of what it looks like. So your traditional Medicare, you have your red, white, and blue Medicare card, and it covers the Part A I told you about, the inpatient, the Part B, the outpatient. You pay separately for a Part D drug plan. And you can have a Medigap plan, meaning something you purchase specifically to pick up those deductibles and co-insurance that Medicare may not cover. Okay? Something to help you along the way. So you're paying for each of these separately. So kind of contrast that to a Medicare Advantage plan. Medicare pays, or CMS, Centers for Medicare and Medicaid Services, pay a core amount of funding to an insurance plan, a commercial insurance plan, to provide basic level benefits for Medicare. That's your Medicare Part C. It covers your Part A, it covers your Part B. But when we think about the deductibles that we have today in Part A and B, you have whatever the insurance plan determines is your deductibles, co-insurance, that type of thing, what you're paying for in that plan. The caveat to having that insurance is that you have to maintain your Part B premium. So you have to be paying for your outpatient, your Part B premium. Today, a Part B premium for someone coming on runs in the $130 a month range. So you have to pay for that. Then you have to pay any premium, and there are $0 plans, but then you have to pay any premium for the Part C. To look at it another way, Part C is actually everything rolled up into one. It's your A, your B, and your D, because typically they include the drug plan. You can buy a few plans that don't, where you pay separately for the drug plan, but it includes all three. So a little bit more on that. So I already told you you must be enrolled in Part B, and that's because that premium has to be still being paid in. Because remember, Medicare or CMS is supplementing these groups. You have to be eligible for an original Medicare plan, so you have to sign up traditionally to get on board. And the annual enrollment, once you get on, you can change plans every year. And that's typically why I come to talk to you this time of year. So the open enrollment period is from October the 15th to December the 9th for you to choose a different plan. Now, again, with that consumer hat on, right now if you were to look on the My Medicare, so how many go on the website and you have a My Medicare account where you can go in and compare plans? You have yours? You can look, you can do your Medigap. I encourage you, if you use the internet, it's very easy for you to use, for you to sign on and use the My Medicare. It's mymedicare.gov. mymedicare.gov. You put in your personal information, just your new Medicare number. Does everyone in this room have a new Medicare card? That's the other question that I get asked a lot is, earlier in the year when they were rolling them out. When am I going to get my Medicare card? What's it going to look like? Is that the same as my old? Did anything change? No, we're just protecting your Social Security number. That's the easy answer. No, we're just protecting your Social Security number. So right now in Oklahoma, in Payne County, if you typed in 74074, which is what I typed in this morning, and I wanted to search for how many plans are available for me to buy or to compare for a Medicare Part C Medicare Advantage plan. Right now, today, there are 5 current options that include the Part D drug plan. They are all under one company. They're all Humana plans. And then there are 2 plans that you can purchase that do not include, if you have your drug coverage, do something else. The premiums for those range from $0 to $99 currently. That was down a little bit, to be honest with you, from the plans that I showed last year. The good news is that is inclusive. So some of them, depending upon at which level, what you remember, you get what you pay for, so they're going to charge you more for more types of coverage, or for you to pay less out of pocket, or less co-pays, or this or that, just like anything, right? So dental, vision, at some level. I'm not saying it's a large coverage. Everything is determined upon the plan, but at least you have some dental and some vision, which you do not have with Medicare. Some of them include some hearing coverage. And then of course you have your drug coverage. So, as a consumer, might be something to consider. It's one of those things that you want to put a pencil to paper. What are you paying for now? You say, well, Tammy, I like regular Medicare. I don't have to think about it. I don't have to worry about it. I go, I lay out my red, white, and blue card. Medicare does their thing. I have a supplemental policy that I've paid for the last 15 years, and it works well. You're golden. If that's your comfort level. As consumers, we all need to find where our comfort level is, and we need to go with that. If you find that frustrating and you have, some non-covered things, or, maybe you are thinking of moving to a different area, you might want to look at what your options are with the 7. Again, compare it, and there are people that work with brokers, with insurance companies, and I'm always welcome to sit with anyone and help them to compare their options. Next question, what's a Medigap? I get that book in the mail every year, and it talks about Medigap. What is a Medigap? Medigap policies were put on the market specifically to help someone cover their deductibles and coinsurance when they began to rise. When Medicare began putting more burden onto the patient, it comes out to about right at 20% for your coinsurance of what you and Medicare share in the allowable amount that they'll pay for any given service after you've met your deductible. Annual deductibles right now, $183 for your outpatient deductible, and $1,340 for your inpatient deductible per benefit period. So you can see where having a supplement is important to help you cover those costs in addition to your coinsurance. So Medigap was insurance companies coordinating with the Medicare program to automatically send your claim after Medicare paid over to your Medigap plan, and then you didn't have to worry about it, and then you would just receive an explanation of benefits of what was covered, depending upon the plan that you had. Okay? They called it Medigap, bridging a gap between what Medicare pays and what the patient owes. Okay? Makes sense? Then you have secondaries. So how many of you, because a common question that I get is, should I look at going from my secondary, my former employer plan that I use as secondary to Medicare, to a Medigap or a supplemental policy? So how many here use your former employer, whether that be OSU or anyone, as your secondary insurance plan? Typically it's Health Choice. Yep. Yeah. So that's good. You pay a premium every month for that secondary plan. You have it that serves the same purpose. So when you heard me talking about the Part C that includes your vision and your dental, I'm well into that you're carrying that continuing, because it has your dental and your vision and your drug plan. Is that right? And you pay a premium for that. It's serving the same purpose. That's your secondary. So that's the difference. Medigap, designed for one purpose only. Secondary is an original group-sponsored insurance from your former employer, typically. That's the most common thing. And you're able to carry it because your former employer allows that plan to revert to a secondary plan and allows you to use it with your Medicare. It's a pretty cool deal. So as a consumer, I'm going to have you put that hat on again, I would compare it. I would look at what you're paying for your secondary. And again, there's that same internal conflict that I know happens, and you're thinking, oh, but it's so comfortable because I know it's worth it because they pay. And that's your comfort level, and that's okay. I think that's a good thing, because a lot of times that weighs more than $100 here or $100 there if you're able to do that. But you put it to dollars and cents. How much do you pay? How much do you pay for your Part B premium? And then you look at a supplement. What do I get with a supplement? What would I have to pay additional for vision and dental? And then you add it all up. And then you decide, what am I comfortable with? What works for me? And as a consumer, that helps you to kind of be comfortable in our healthcare skin, so to speak, okay? Right now, if you were going to shop for supplements, it's easy to do. I love the way, not just the CMS website, the My Medicare website, but other insurance plans have put this out there. They're in a grid. They're laying side by side so that you can see them. They are, again, let's go on the alphabet soup thing. They're A through, I know you're shaking your head, you're like, oh my gosh. They're A through N. There's actually 11 plans because one of them, for whatever reason, they came out a couple of years ago and offered a high deductible supplement plan. But that's the HD that I have there. So they're sold, there's a variety of coverage. Some cover both deductibles for your inpatient and outpatient. Some do not cover the outpatient deductible. Some they make you responsible for 50% or 75% of the co-insurance. They're only going to pick up a part. All things are relative to the premiums and what each covers. The websites are great. You go in, I think I have a copy, yeah. So I don't think you can see this real well, but at least I can explain it to you. When you go in, they list all the plans. And when you get to this point, you're talking in letters. My oldest brother retired last year. And he can call me, he knows we're getting this open enrollment period, and he's saying, sis, I've got an F. Do you think I need to move to something else? I'm looking at a C. So you begin to talk this alphabet soup language. It's amazing how fast we get into this. So there's check marks. It tells you what of your coverages, your inpatient, your outpatient deductibles. It tells you what is covered on these. These plans that have the 50, the 75%, that's telling you that you're going to owe 50% or 25% of the co-insurance or the deductible. They're sharing it with you. Therefore, I would guess if I could see the premiums on those are probably less. Okay? So it allows you as a consumer to do some shopping. All right. So before I go into Q&A, I want to just talk a little bit about thoughts on consumer and patient and what our responsibilities are, or what I recommend that your responsibility be. Ask questions. One thing I like to remind everybody is that the Medicare program provides you with wellness benefits, and we want to use those. You want to have your screenings each year. You want to ask questions, your mammograms, your PSAs, heart screenings, those type of things, which are typically testing. There's time limits, so you kind of have to keep track. If you're a person that's eligible for a colonoscopy, you want to make sure that the right number of years passes before you go for another screening. So there's lots of rules. That's us as a patient, but we also have to think of that consumer side that healthcare has put us in today. So don't be afraid to ask questions, because navigating all of this has become very, very complex. And I encourage you to ask your doctor. I encourage you to ask their nurse, the front office staff. I'll give you my number to call. We have a customer service team that is awesome. And if they don't know the answers, because not all of these people work directly in that world every day, they have access to someone who can provide you with the answers. We need to take ownership of that. That helps us to feel more comfortable about our process in our health and in our care. Okay? Oh, I like that. Nice. So, my final thoughts in this part of the presentation is to become a better consumer by asking those questions. It's also going to help you become a better patient, a healthier patient, someone who takes control of their health and their care. And know that all of these rules that are around us, because of the managed care environment that we are in the United States, one, we're blessed to have access to all of this care. And we are blessed to have all of these options to even choose from, because in other countries they don't have that. But on the other side, don't let it get you down. You know, I do this because when I came into healthcare more than 25 years ago, my grandmother was carrying around a shoebox. And it had her bills and all these kind of things in it. And I sat down one day and decided that's going to be my plight, to go through this shoebox, to go through not only the medical bills, but all the bills, and let's decide what's in here and why they're there, and let's explain it to you. Let's help you to understand. The next thing I know, standing at my door, is lots of other women that were widowed and had shoeboxes. So I decided then that it was my lot in life to learn as much as I can about things like Medicare, Medicaid, you know, what its purpose is, all of those things, because not everybody has access to or knows where to find the answers. But as consumers, if we ask enough questions, we're going to get the answers. And I truly believe in my heart of hearts that's what you need to do. Okay, I didn't quite hit the 45. That's good. So I am going to switch to questions now, because I can see your faces, and like I said, I didn't get quite in the weeds today as I usually do when I present to you, because I want to answer your questions. If I'm telling you to ask, I want to be responsive.
Okay, so raise your hand. I see Mr. Brennan over here, so I'm making my way over here. Raise your hand and make eye contact, and we'll bring you the mic.
Very simple. I'm just wondering what your phone number is.
Good question.
I've got cards up here, so we'll gladly share. Yes, ma'am.
I'm not old enough for Medicare yet, but I'm trying to get smart. And I'm just, you know, I have no idea what this even costs, but it's got to be less than what I'm paying, which is about $1,100 a month.
It is less than what you're paying.
Okay, well, like, what does it typically cost for Medicare?
Oh, okay, so
I know it depends on which option you choose,
right.
but
So let's just talk about traditional Medicare. So whether or not, if you were to come on today, right now, I believe the premium for new people 65 coming on Medicare, that Part B premium is $135 a month, $134. Beyond that, there really are zero premium Part C plans. The supplement plans, depending upon what you purchase, you know, do you want it to cover the deductibles? Do you want it to, you know, cover your co-insurance? Do you want it to cover 100%? You might pay, I helped my brother last year. I believe he's bought a plan that pays, that he has to pay like $200 a month.
I guess I don't understand if it's a Part C, the Advantage, which covers everything, how you can have a zero premium.
I don't either. You might want to talk to a broker about that.
I mean, my sister just did this, and I go, there's something wrong here. It can't be zero.
Because it's about the amount that you'll pay. So remember, here's what, and that is what's confusing about these plans, but as younger people coming into the Medicare age, we've got to start watching that and paying attention. Here's what I've learned. So because Medicare said, hey, commercial plans, we want to partner with you, and we will take from the Medicare, because you can offer more benefits and you can help offset the long-term expense of care, because you have another risk pool also within your companies. So we're gonna pay you the core amount to sponsor the A and the B. Beyond that, the patient would have to pay more. So the only thing I could think, because I can't get into like purchase that part to see that, depending upon the plan, is that you're going to also have a larger portion that you pay, and it may not be these same deductibles. And you're going to have a network that you stay in. You can't just go anywhere. Remember, Medicare is a nationwide plan. So if you have the red, white, and blue card, you're going to use original Medicare. You can go anywhere in the United States. And as long as you're going to a participating, a doctor that participates in the Medicare plan, or a hospital, which most do, you can go anywhere in the United States. If you buy one of these other plans, you're going to stay within a network.
It's also my understanding that because we live in Stillwater, we have one option for Medigap. Whereas if you go to Tulsa, you've got community care and all these other options.
Okay, not for Medigap. So remember, Medigap is your supplement. And so you have several options, several
I
companies.
thought you said it was only Humana.
Yeah, that's your Part C.
Okay.
your Part C. Right now, if you look on the website, Humana is the only one with options here in this part of the state. You're going to find that in rural areas. So your Tulsa and your Oklahoma City, your metropolitan areas, there's probably more choices. Right now, in Payne County and the surrounding counties, there seems to be one.
It's also simple.
Does Medicare pay for the helicopter to transfer you from an accident to the hospital or from the hospital to another hospital?
Medicare's transportation coverage is lacking. It pays for ground transportation, and it's rare when it pays for air. It is possible through appeals and things like that, and I don't know all the nuances of the air coverage, but it's very expensive and not.
We get these in the mail,
Mhm.
and I just wondered whether I need to be concerned about it or whether I need to ignore it.
You get, the
It's an
offering.
air evac.
Air evac.
Right, yeah, and there's more than one company out there
There
too,
is.
so.
There is. So again, put your consumer hat on, shop around, see based upon the cost. You typically pay a monthly or an annual fee, but no, Medicare is not.
That's what it is.
Medicare's not going to be our friend when it comes to air ambulances.
It's fairly inexpensive, that insurance that they're offering, whether it's that one or the other one. Air Methods is the other company, I think, are they still called Air Methods?
Maybe, I'm not real,
But there's two different companies, and the hospital does use one a little more regularly. They'll be the first to respond typically because I think they have more aircraft. And like my children, I have a daughter who lives in another state, and she is covered under that as well in my family plan that we get. But it's usually around $100 a year. I don't know if that changes depending on age or not, but.
now for that, and I wasn't thinking about that. So you will see a helicopter sitting on top of Stillwater Medical Center, and you do have an option to buy into that. And it is an annual fee, and it is very economical.
We have a question right here.
Yes.
You mentioned that we're in a re-enrollment period right now.
Yes.
If you are happy with your plan, do you automatically roll into, just rolls over
It
to
just
the next
stays.
year?
Yes. So starting the 15th, we start open enrollment period.
Yes, sir.
We have a doctor who accepts Medicare and then complains about it daily. Tell me the difference between one who does accept and one who doesn't accept, or is there a difference or whatever? Thank you.
There is a difference. So on the physician side of things, or on the provider side, everyone has an option to become a Medicare provider. And they have to abide by some rules, but you sign up. What you're doing is you're agreeing to accept Medicare's payment, meaning you would only balance bill a patient for what Medicare says the patient portion would be. There are physicians that choose not to. Most physicians in this area are Medicare participating providers. But what you're doing is agreeing to accept what Medicare pays for a given service and only billing a patient for the amount that Medicare tells you to bill the patient.
And I think, and you might, I don't know if you want to address the issue of complaining about it, but I do think that oftentimes the staff of those doctors have to chase and explain, just like we all do oftentimes in insurance. We have to explain and re-explain because sometimes insurance companies want to do everything they can to not pay. And I'm sorry if you're
That is true.
with an insurance company, but that's
It is.
that's the way they don't lose money,
So
unfortunately.
when we think of healthcare and our doctors, we serve for different purposes. They're here to care for patients. Insurance companies are here to serve the investors that sponsor the company, and then their beneficiaries who pay the premiums. And sometimes, well, it's not sometimes. In the United States, the incentives for all of us involved in this do not align. You want good health care, and you want a relationship with a physician. The physician wants a relationship to you, and he wants to do, or she wants to do what they were led to be, and that's a doctor to care for patients. We need the insurance plans because of the way healthcare is now, because I can't afford to pay out of pocket 100% for my care. So then there's relationships, contracts, rules. And to a physician who only wants to care for a patient, that can be very frustrating.
And in the defense of the insurance companies, they're just trying to avoid fraud
Yes.
and abuse. And so that they're doing their job as well to some extent, so.
Absolutely. And they want you to ask questions too. They don't want to be billed for anything that is not necessary.
I am not computer savvy, and I'm a wishy retiree, and I'd like to see about changing my Medicare plan. Where would I go?
There are companies here in town that will
So
set,
I want to stay with Medicare, I just want to change
yes,
the plan.
yeah, you want to change. You're with OSU, they're currently your secondary plan, and you want to make a change?
Yes.
Okay. There are companies here in town that will help you to navigate that. I can give you further information on a phone number that you can call that's a state organization that helps us navigate the Medicare program and how to buy supplements and that type of thing. And you can always call me and I can connect you to that. So again, I've got enough cards here to give to everyone that wants one.
Yes, ma'am. Oh, you want a card? Okay, we'll get you one.
Cards for
Cards for everyone.
Cards all around.
Smiles.
Oh my goodness.
Smiles for everyone. Yes, I have another question right here.
No, I want a card.
Oh, you want a card?
Before I turned 65, I was recruited by this HMO, Community Care. Wonderful speech, wonderful, everything. And she said, we're not going anywhere. Okay. 1 year later, they were gone, and I had to find something else. So I found something else, but that makes me leery of the Advantage Care plans. And then most of them are not available in our area anywhere, Stillwater people. But you said Humana is?
That's who's selling in this area right now, today,
this year.
this year.
I'm not sure I want to
This
take
year.
a risk.
You're right, and I do want you to be cautious of that. So you saw the terminology that I went through today. So here's another consumer tip. And I have to say, when you tell stories like that, and the many people that have told stories of going to Walmart to a table that was set up and all you wanted to purchase was a supplement, and only to realize after January of the next year that you had just opted out of the traditional Medicare program and you now are in a Medicare Advantage plan. That does frustrate me, and that's why I want to empower you as a consumer to ask questions. Make sure if you have a problem reading the form, because believe me, some of it is very small print, get a friend or bring it to someone to help you understand, and ask them questions. And now that you know these terms, ask them, are you a Medigap or are you a Part C? And you want a direct answer, because either one of those questions takes a straight yes or no.
I was wondering if anyone had any experience with the AARP or B or whatever it is prescription, and also OSU is Blue Cross Blue Shield now. So I don't know if anybody's, I don't know if this lady up here knows anything about how they work.
So your question's for the room.
Yes.
AARP, do we have people that are carrying AARP supplements? So I will tell you, AARP supplements have been around for a long time. And I'm sure that they are among the top supplements, Medigap, that are being used probably across the United States, because they are such a big organization. And when you go through, if you'll remember that screen where I showed you all the columns with the there's an AARP plan for each one of those, as well as many other options.
We have original Medicare, we have a Medigap, and they pay everything. But the premium is so high.
I know.
I don't know how to compare whether we want to go to the Advantage. And if we travel, if that's a challenge.
Okay, so there's another question. Some of the Advantage plans will allow you to go out of network, and it tells you what rates. So the Medicare Advantage plans work like current insurance plans with an employer, in that they have in-network and out-of-network. Most of them sold in this area are PPOs, which is called Preferred Provider Organizations. That allows you a little broader travel area, and some of them you would have to look at the specifics of the plan and see what's the difference in your amount that you're going to owe if you go outside of that network. If we leave Oklahoma. So if we leave Oklahoma, if I want to go over to Branson and something happens, you know, the questions to ask are, do you cover emergency care across the United States? Okay? Because if I'm traveling, if I'm not moving somewhere, my main concern is going to be, if something happens, if Olin and I go, you know, on a big road trip, and we're going to follow Route 66, you know, something happens to me along the way, what's that mean? That's how you begin to evaluate, is it worth the difference? Because like you said, right now it's so expensive what you have. These look kind of enticing, you know? Maybe I should explore this. But you need to see what the real difference is based on your lifestyle.
So you can help us with something like that?
I can help you. I won't help anybody decide on a plan or an insurance, but what I will do is I'll help you navigate it.
Okay.
We can lay it out and look at that.
Another question? Yes. My best Bill Donahue.
I travel quite a lot internationally, at least 2 trips a year or so, and I'm now covered by Medicare, which I know doesn't cover international travel. I also have OSU supplemental. So what do I need to know as I move through to another country?
So with that OSU plan, so if you were to buy let me see if I can go back and find this screen for you, because it helps me to talk. Okay, so this is, what this was is when I talked about supplements, okay? Not the Medicare Part C, but a supplement, something to supplement your Medicare. These are beginning to get kind of pricey, as we just said. But if you'll look at this line right here, where it says foreign emergency travel, up to plan limits, it will pay 80% of whatever the plan says that it covers. This is on a supplement policy. So it does cover something for foreign travel, knowing that Medicare won't. For your OSU as your secondary now, I think the question is to look at that plan, and do they have some type of provisions for foreign travel? And it will probably be, I mean, nobody's going to cover 100%, but there's going to be something. Maybe it covers an airlift home. The travel package that I got going to Uganda, the only thing it was going to do was get me an emergency transfer home. And that's okay. As long as I got back to the U.S., I was going to be good. But so you kind of have to look at that, and I'd be happy to look at that with you.
Great questions. Who else?
I thought it was interesting in yesterday's paper, I don't know if anybody saw this, but Oklahoma has the second highest rate of residents without health insurance. Not that that has anything to do with Medicare, but I just thought, oh my God.
But it really has everything.
No wonder mine is so high right now.
So what she said is, in the paper yesterday, or was published, that Oklahoma has the second highest rates of citizens that are uninsured.
What's first?
Texas.
Okay. And a lot of the plans that we share, you know, Texas, Oklahoma, a lot of our plans are similar. It's sad to me. You see the complexities of what I try to break down in simple terms, and I wish I could make it even easier. But to navigate this, our exchange plans, where you go on the web, and you know, Oklahoma did not participate, or didn't participate in the exchange, so it's just the federal exchange, and we're very limited on what people can purchase. High deductibles are rampant, even with and some of our employer plans, because the premiums are going up so much. And that's why some people opt. If I'm gonna have to pay that much anyway, the mentality has become, why bother? Because it's expensive, and because maybe we don't know the right questions to ask to see what the coverage would be and to be able to weigh our options. Okay? Well, I appreciate you all so much. And please, I've given you the cards. Just, I think some of you I may have talked to in the past. So here's how I work. My job has me very busy in and out of my office. The phone number on there, call and leave a message. What I typically do is Friday afternoons is when I return these kind of phone calls to set up an appointment with you. Have you come to my office, we sit down, I show you the computer, or if you need things printed off or whatever, I try to work with you and see how I can best help you navigate the business of healthcare. Okay, so I appreciate you, thank you, and God bless.